On behalf of the faculty and staff of the Yale School of Public Health, I congratulate the members of the class of 2022. We are gathered to celebrate your achievements and acknowledge this graduation milestone. My colleagues and I welcome, thank, and congratulate all who played a critical role in shaping the aspirations of all of our graduates of the Yale School of Public Health and contributed to your success. These special people extend well beyond Yale, most notably including your parents or guardians, your role models, your siblings, your grandparents, your extended family and friends, and for some of you, your spouses or partners and your children. We want to thank all of you who have made this possible, made possible the academic and life journeys of our graduates. So families and friends of our graduates, please accept our heartfelt gratitude as we pause to applaud your contributions to our YSPH graduates. Now I address our MPH graduates. The past 30 months have thrust our school and our discipline of public health into the spotlight. As we've striven to overcome this historic pandemic threat, our school's faculty have highlighted the social inequities that inhibit wellness in the most vulnerable members of our population. These have included the institutionalized elderly, our frontline workers, our healthcare workers in homes and long-term care settings, in clinics and hospitals. Special efforts are needed for persons with disabilities, those with social isolation, those with housing, food, or employment insecurity. All these persons have been highlighted in your studies, and for many of you, your experiences as you studied here in New Haven. Whether for COVID-19, maternal mortality, or injuries, death rates confirm racial, ethnic, and economic disparities in both risk and access to prevention and care. Our environmental scientists work on global plastics, toxins, climate change, and safe air qualities in buildings. Our epidemiologists, biostatisticians, and modelers have worked to unearth the causes and solutions of the COVID-19 pandemic and to forecast its course, as they have done for TB, HIV, vector-borne diseases, and a host of other tropical and local infections. Our social and behavioral scientists have refined health communications and messaging for risk reduction and wellness, also examining the structural determinants of illness. Our biologists have helped discover new diagnostics, new therapeutics, and vaccines, unearthed some of the origins of disease pathogenesis. Our policy and management faculty have tackled a myriad of systemic flaws in our health system, issues in tobacco and substance use, and vaccine policy, to name but a few. Our Office of Public Health Practice, our Office of Communications, our Office of Alumni and Development have striven to engage our various communities with new vigor, helping transform our relevance to our university, our alumni, our city of New Haven, our state and region, and even at national and international levels. Our Emerging Infections Program and our Community Alliance for Research and Engagement, that is a full partnership with Southern Connecticut State University, deserve credit for their massive community service. Public health is more visible than ever within society, and we see the compelling issues highlighted by media and policymakers alike as never before. YSPH students, staff, and faculty have worked with nursing homes, school districts, arts organizations, Yale alumni, other schools at Yale, and our partners in low and middle income countries of Africa, Asia, and Latin America. We've engaged our city and our state, as well as our governments and institutions in other states, including New York, Rhode Island, even Kentucky and California. Our strong community has been on the forefront of Yale's response to the pandemic and continuing our momentum in the many compelling themes of healthcare reform informatics and data sciences, control of chronic infectious diseases, promoting healthy mothers and children, seeking healthy aging paradigms, and addressing LGBTQ health, protecting our environment, and adapting to change, just to name a few. All of you graduating in 2022 have attended YSPH in a historic moment for our nation and our world. Our community embodies boldness of vision, persistence in the face of obstacles, and a commitment to public education and welfare in its health challenges. The public health workforce, into which most of you will enter, works in society's shadows. After all, a patient assisted by a nurse or a doctor is fully aware of the benefits that might ensue. But a community kept safe by public health insight and exertion may be quite unaware of the hazards prevented or mitigated. In this year of 2022, you've equipped yourselves for further study or for immediate entry into the health workforce with skills that the world needs urgently. I have one hope for all of you. That is that your career is such that you wake up on a Monday morning to welcome the work week for the ability to improve our society and the world each and every working day. Despite constraints due to COVID-19, I hope you leave with pride in your alma mater, knowing that your studies in public health happened at a truly historic time of challenge for our university, society, and global community. When people ask me about the best part of my deanship since 2017, I can say that the passion of our students, staff, and faculty have motivated and invigorated me to strive to improve our school and our disciplines. Meeting our future public health leaders, all of you, has enabled me to learn about your accomplishments, plans, and aspirations. While our world has its immense challenges, I have a tremendous sense of optimism for the future of the field of public health as we turn the mantle of leadership over to you, our new generation. I speak on behalf of all the faculty and staff when I say that we've been honored to work with you, guide your education, and learn from you. It now gives me great pleasure to introduce Nandini Deo. Nandini has been chosen by her and her peers to deliver this year's student address. Nandini's passion lies in community-based trauma prevention. Prior to her time at YSPH, she worked in federal and state HIV, STI, and TB prevention at the CDC, the Oregon Health Authority, and the Utah Department of Health as well. During her time at YSPH, Nandini has had the privilege of working on the Border Identity Stress Team, led by Dr. Skylar Jackson, to capture the psychosocial experiences of individuals who defy binary identification across race, gender, and sexual orientation. She's also worked under the guidance of Dr. Keitra Thompson as a qualitative evaluator for the MOMS Partnership in the Elevate Policy Lab, aimed at reducing depressive symptoms and increasing social and economic mobility for low-income mothers. In addition, Nandini has served on the board of Yale's Emerging Majority Students Association and as a teaching fellow for the Health, Equity, and Social Justice and LGBTQ population health. She looks forward to rejoining the public health workforce post-graduation with the ultimate goal of pursuing a doctorate in clinical or counseling psychology. It is an honor and an absolute delight to invite you to the podium, Nandini Deo, our 2022 student speaker.
Thanks, friends. Hi, good afternoon. I can't believe this is actually happening. Amazing. So writing this graduation speech felt a lot like graduate school. Me and my bestie Google against the world. You can't exactly Google how to write a graduation speech for a class that voluntarily studied public health amidst a global pandemic, but for what it's worth, I'll have you know that I did try. Google said to find a powerful hook, something compelling, profound even. So I went to the next best place that I knew wouldn't fail me, academic Twitter. As expected, I found myself in a rabbit hole where I understood about 30% of the vocabulary and even less of the theory, and based on this excellent knowledge base and a vague interpretation of others' profundity, here I am in front of you all. The last speech I wrote began with a quote from the Dalai Lama, and this one's from an organizational psychologist with an impressive Twitter feed. So academia has, simply put, broadened my horizons. Adam Grant wrote in less than 280 characters, "Too many people spend their lives being dutiful descendants instead of good ancestors. The responsibility of each generation is not to please their predecessors, it's to improve things for their offspring." This tweet actually reminded me of a conversation I'd had with a supervisor in my early years of public health who advised that our role in this field was to water a garden, consistently, meticulously, whether or not we'd ever see it bloom. It's taken me many more years and experiences with you all to realize that our garden is literally the entire world, and that watering it comes in many different forms, from improving water quality to increasing hygiene and sanitation in conflict zones, modeling the impacts of major health policies, fundamentally restructuring our healthcare systems, designing sustainability interventions to ameliorate climate change, analyzing and triangulating millions of data points in an effort to reduce transmission of disease, and finding new and creative ways to motivate belief and behavior change. Now more than ever, it is clear that public health impacts every system on every corner of this earth. It's an exciting realization, perhaps coupled with big, fat overwhelm, because our careers are often a labor of love, with the central goal of improving life for those who may come after us. In a field so broad, ever-changing, and now highly politicized, what does it mean to become a good ancestor? I'm not going to pretend like I know the answer to this question, or that I'm even under the assumption that there is one answer. After all, one of the many things we've learned at our time here at YSPH is that there are many truths, and we will be tasked with making room for them all. This program did, however, train many of us as researchers who use observation and conversation to make meaning and consider solutions. So this is my earnest attempt, without sounding too much like a live, laugh, love sign, to give it my best shot. I do believe that a good ancestor is driven by hope. When I began this program 2 years ago, my aunt, a fellow public health practitioner, sent me an article called Hope, Cynicism, and the Stories We Tell Ourselves. The article astutely remarked, critical thinking without hope is cynicism. Hope without critical thinking is naivety. This seemed at the time, and even still, the perfect description of the public health conundrum. The call to hope is really a call to retain a critical mind and a soft heart. A critical mind to question everything: the methods, the systems, the dissemination strategies, the funding mechanisms, the theories, the power differentials, the service delivery. A soft heart to remember why we do the work, to see communities thrive, to continue to believe that change is possible, to give the gifts that we were given and the gifts we've cultivated to create a world that people actually want to live in. Here in public health, hope isn't really an option, it is a necessity. As practitioners of public health, regardless of our concentration, we witness up close the very worst and the very best that humanity has to offer. This reminds me of a text chain my roommates and I sent after opening one of our readings last spring, The Epidemiology of Human Suffering. Amazing, we said, what a warm and fuzzy field. Many of us have seen patients turned away because of lack of documentation, have contended with harmful policies passed after decades of health advocacy, have witnessed public trust dwindle throughout the COVID-19 pandemic, thwarting infection reduction plans. Still, we continue to find hope through many different avenues. Hope comes in moments of curiosity, in moments we feel compelled to ask questions about ourselves, others, and the world around us. Curiosity cultivates hope through refusal of stagnation. It insists there must be more. New options, solutions, considerations. I hope you hold on to the power of asking, but why? Hope comes in moments of love, Before many of us knew each other, we were just tiny boxes on Zoom screens, smiling when our roommates or partners or family members said something from off screen, mouthing thank you to the person who delivered us hot tea, or laughing when our pets entered our screen, pausing our attention to text our friends back mid-lecture, and creating new relationships through Zoom chat. Love cultivates hope through remembering that we are all whole people with full lives. I hope you continue to foster love in your everyday life so you can continue to extend love to the people you serve. Hope comes in moments of creativity, when we utilize a combination of imagination and evidence-based practice or a new strategy or a novel method. Creativity cultivates hope through the recognition that public health and medical systems that we live within were created by someone. Why wouldn't we create the next iteration? I hope you acknowledge your power as an individual who will shape the future of health. Finally, and in my unsolicited opinion, most importantly, hope comes in moments of humor. Humor, I think, is humanity's most endearing survival tactic against adversity. We laugh about irony. We laugh hysterically when sleep deprived, something I'm sure none of us can relate to. We laugh filled with adrenaline when we exhibit bravery to speak truth to power. We laugh to connect with others, to release tension, to try again and again and again. I hope you find humor and connection to keep you grounded. Class of 2022, I don't know exactly what it means to be a good ancestor, but I do know that you are all it. Your bright minds, your curiosity, your ability to hold the worst and the best the world has to offer, your wit and your humor, your critical minds, and your soft hearts. We're entering the field of public health at a time in history when our hope is so desperately needed, and I do believe that we have some to spare. I can't wait to see you out there making your corner of the world a better place to live in. Congratulations.
Nandini, thank you very much for those words. We're very grateful. It's now my privilege to introduce our distinguished 2022 commencement speaker, Dr. Heidi Larson. She has to present to us from the World Economic Forum in Davos, Switzerland, because she was previously committed to that event. Professor Heidi Larson is the founding director of the Vaccine Confidence Project and is professor of anthropology, risk and decision science at the London School of Hygiene and Tropical Medicine. She also holds a clinical professorship at the University of Washington and a guest professorship at the University of Antwerp in Leuven. Her research focuses on the analysis of social and political factors and managing risk and rumors, including digitally enabled disinformation that can affect uptake of health interventions. Her current research is particularly focused on issues around public cooperation during emergencies, disease outbreak, natural disasters, terrorism, and conflict. Professor Larson previously headed global immunization communication at UNICEF, chaired Gavi's, that's the Global Alliance for Vaccine Immunization Advocacy Task Force, and served on the World Health Organization SAGE Working Group on Vaccine Hesitancy. She is author of a book called Stuck: How Vaccine Rumors Start and Why They Don't Go Away, published in 2020 by Oxford University Press. She's published widely on the drivers and enablers of vaccine confidence. In 2021, she was awarded the Edinburgh Medal in recognition of the role she has played in recognizing the importance of popular and widespread misunderstandings of vaccines. BBC also named Professor Larson as one of the 100 most influential women in the world in 2021. Dr. Larson joins us via cyberspace to give her 2022 commencement address to the MPH class of 2022. Graduates, faculty, staff, families, and friends, it's a pleasure to introduce my friend, Dr. Heidi Larson.
Congratulations to all of you, and I'm really sorry not to be with you in person in New Haven, which I would have loved to do, but I'm really grateful for the opportunity to pre-record this address. And I chose to record it in the Science Gallery here in Bengaluru, India, where I've been collaborating in an exhibit on contagion, and thought it was an appropriate setting to be addressing you, given their inspirational efforts at making science more engaging and accessible, which is foundational to public health. Well, what an important day this is. It's a milestone in your public health careers. It's actually the beginning, the commencement of your learning, a different kind of learning, a real world learning, and your leadership. You are some of the top public health emerging leaders in the world, and we're all counting on you, particularly after this challenging couple of years. You couldn't have had a more meaningful time to earn your public health degree than in the context of this current pandemic. You've also seen the real world reality of public health outside of your classrooms, the swirl of politics, of publics, and science, all competing sometimes and not cooperating while trying to cooperate for attention. Thankfully, not all public health work is in crises, and the best of public health work helps to mitigate and prevent extreme health outcomes in the context of crisis and other settings and emergencies. As we slowly and hopefully exit from COVID, all eyes will be on building preparedness and resilience in the face of the next challenge, whether it's a serious disease outbreak or other events such as natural disasters with their health consequences. We will also need to address the many health needs that were overlooked or neglected because we had all eyes on COVID in these past couple of years. Some of these issues, like even mental health, which were exacerbated, made worse during COVID. I read a recent report that the pandemic led to an additional 53 million cases of depression in the world since COVID. We have a lot of work to do. As you choose your path after graduation, because public health embraces so many different paths, and the wonder of public health and what I've loved being an anthropologist working in public health is the diversity of people I've worked with. My research group, the Vaccine Confidence Project, we have computer scientists, mathematical modelers, psychiatrists, political scientists, epidemiologists, vaccinologists, and it's the wonder of bringing these disciplines together to ensure a more robust public health. The biggest message I can give you when I thought about what can I tell such a brilliant group of graduates after everything they've already learned. And one of the key messages I thought was, be open, listen carefully. This is the beginning of learning. Everyone around you, as you enter into your chosen role, setting that you work in, you'll be around people who each of them has had a different experience these last few years, different challenges at many levels. Building the trust of those you work with in your new setting will be crucial to building trust. Listening in even small ways to what they've been through as a gesture of caring about the others. Public trust has been a key issue, a key lever of public cooperation around the multiple restrictions and challenges we've had during COVID, imposed on people for the greater good. Well, what we as public health community feel is the greater good wasn't necessarily felt to be the greater good locally or for some populations. This has been a challenge and a relationship building time. Countries where there was higher trust in government fared much better than those who didn't have as much trust in government. We learned, for instance, in our global vaccine confidence research that the biggest predictor of COVID vaccine willingness was actually the perception that government was handling the pandemic well. The more confidence in a government and how they were handling the pandemic, the more willingness to accept a vaccine that was administered, regulated, and sometimes required by government. I care passionately about public trust, and I'm hugely concerned about the recent World Economic Forum risk report, which rated social cohesion erosion, the ability of society to cooperate, as the global risk that worsened the most dramatically during COVID, during the pandemic. We could have thought and hoped that this would have been a time to embellish and strengthen social cohesion. But for whatever reasons, some of which were very different in different settings, social cohesion and cooperation didn't fare as well, but they're foundational to public health. And this will be absolutely crucial for you to consider and think about how you can contribute to rebuilding it in your work ahead. My second message, besides be open, listen carefully, is be ready for surprises. One of the biggest learnings of the pandemic has been the importance of being responsive to changing circumstances, uncertainty, even changing science, evolving science. That's been one of the biggest challenges of the pandemic, keeping the public on board while the information was changing, weighing what was the best available evidence to make the best decisions, recognizing that they may change. This is not the stuff of textbooks, of linear thinking about evidence to policy. Multiple types of evidence and situational awareness weigh into public health decisions, knowing that, again, they may need to change as situations evolve. The world did not stand together in a kumbaya moment to get us through this crisis. The best successes, when people ask me, where did you see successes? The successes I saw were hyper-local. They were local communities. They were giving and caring and mutual trust settings that people pulled together and understood each other's needs. And also the local health institutions, local governments, local schools understood their local community. Local and locality mattered. Because sometimes national leaders, global leaders that we would have expected to line up together weren't doing that, as many pandemic preparedness reports and commissions had anticipated, assumed, or at least hoped. Some leaders, as you know well, misled publics away from the science, down the rabbit hole of conspiracy. In those settings, when you can't have the kind of confidence in a national leader, localness and local leadership, mayors and others in local settings matter tremendously. Religious leaders, others who the public trusts when there is so much uncertainty. What has been particularly striking and concerning about the nature and scope of conspiracy, rumors, and misinformation, a topic I've spent a tremendous amount of time with my research group on this past couple of years, is the level of aggression and anger behind it. There's been tremendous emotion during this pandemic, and somehow moving forward, we're going to need to calm and rebuild a more hopeful, optimistic, rather than angry and anxious public. It's not going to be easy, but I think we're all counting on all of you and your colleagues in other universities to work towards this, to be good listeners and trust builders, because we have a pretty fractured environment, but not everywhere. We need to build on the hope, build on the optimism, build on the local trust. In the beginning of the pandemic, which was an early signal that we had some challenges ahead, I remember nearly 60 5G towers were set on fire. Others vandalized, and workers and tower people working there were harassed. And I was really startled at how extreme the reactions were. And some of it was against people not wanting to be told what to do, how to run their life, and where. As vaccines became available and increasingly required in many settings, as you know, they too have been a trigger of anger and anxiety for some populations, for some people. Some of it was more anxiety than anger. It's uncertain. It was so new. It was so quick. And it amplified. There was already underlying trends of vaccine hesitancy around the world. But where we did well, it was a signal of trust building. I've always been struck, I never expected to be spending nearly 20 years of my life working in the field of vaccine confidence after many years working in AIDS, which was very much more bottom-up than top-down as a pandemic response. It's really been, vaccine confidence has been such a window on people's ability to cooperate. The last message, which I've already suggested and referred to, is to never forget the emotions of publics. And they're more heightened than ever. Publics are hugely heterogeneous. There's no one public, and in that sense, no one public health. They're hugely heterogeneous with multiple histories, beliefs, political stances, and emotions. And all of these factors have influenced their willingness, or not, to cooperate for the greater good. All of these factors matter as we work together for public health and better health. Your effectiveness as public health practitioners will be determined by your alertness and sensitivity to these human factors. We have to embrace these factors without losing the foundational science behind them. While we can think of universal principles for public health and perhaps shared goals, there will be varied journeys to get there. There is no one universal best practice. There are many local best practices. Be open, listen carefully. Be open, listen carefully as you start your journey. And don't stop listening. It's the most important thing that I can think of. Each time you listen, it is a gesture of caring about what the other person or people think. It's a trust builder. Thank you. And again, congratulations.
Thank you, Professor Larson. If you didn't detect a British accent, it's because Professor Larson is from Connecticut. We would like to now acknowledge our student awards for this year's commencement. We ask that all student award recipients come to the stage to receive their award when their name is called. We will be foregoing our handshakes in deference to COVID, but we're allowed elbow bumps and whatever. So the first award is the Dean's Prize for an outstanding MPH thesis, and also the Wilbur G. Downs Outstanding Thesis Prize in International Health. The faculty and I commend all of you for the excellence of your theses and capstone projects. It's my great pleasure to acknowledge the 2022 recipients of these two prizes, the Dean's Prize and the Wilbur Downs Prize. The recipient of the Dean's Prize for Outstanding MPH thesis is, are you ready? Nandini Deo. Nandini receives this award for her thesis, "She trusts us to love her, you know, using a love ethic framework to explore faith navigation and acceptance processes among Mormon mothers of LGBTQ+ individuals." The purpose of this study was to better understand faith navigation and LGBTQ acceptance processes among mothers in the Church of Jesus Christ of Latter-day Saints, in order to better inform public health engagement with highly religious parents of sexual and gender minority children. Nandini, please come to receive your award. The recipient of the Wilbur G. Downs Outstanding Thesis Prize in International Health is Georgiana Esteves. Georgiana received... Could be a long afternoon, just kidding. Georgiana receives this award for her thesis, Support or Interference? Relational Influences on Mothers' Exclusive Breastfeeding Practices in Ghana. Childhood malnutrition is a challenge that needs to be understood as a global health threat. Exclusive breastfeeding is recognized as the best practice to improve a child's growth and cognitive development in the first months of life. The World Health Organization recommends exclusive breastfeeding until 6 months. Mothers need family support to adhere to exclusive breastfeeding practice. This study aimed to understand the interpersonal level relational influences of fathers, grandmothers, and other family members on the mother-child dyad adherence to exclusive breastfeeding practices, as well as document community and societal influences on exclusive breastfeeding. Georgiana, please come to receive your award. The Henry J. Chauncey Jr. Inspiration Award, and Mr. Chauncey goes by his nickname Sam. So the Sam Chauncey Inspiration Award was established in recognition of Mr. Sam Chauncey, who developed our program in health management and fostered its close collaboration with the Yale School of Management. A former secretary of the university and distinguished member of the Yale and New Haven communities, Sam has been both an agent of change and a dear friend of YSPH. This award was initiated by the Health Management Program class of 1999 and is now supported by the school. It is given to the graduating health management student who most exemplifies innovation, integrity, leadership, and community service. This year's recipient of the Chauncey Award is Victoria Clark. Who was also our flag bearer today. Vicki came to YSPH in 2020 with a Bachelor of Arts in Science, Technology, and Society with a correlate sequence in biology from Vassar College, whose president came from YSPH. Vicki deserves recognition not only for her scholarly achievements at Yale, but her impressive commitment to leadership within the university and beyond. She has served as Vice President of the Student Association of the YSPH Board, as well as a healthcare management student leader and peer mentor. She served as a student fellow in the Solomon Center for Health Law and Policy in the Yale Law School, has served as a research assistant in the Connecticut Emerging Infections Program at YSPH on a COVID-19 vaccine breakthrough study, and has aided multiple COVID-19 pandemic-related projects at the school and at the state level. Vicki's ability to lead on multiple fronts with compassion, kindness, and strength has inspired her peers, as well as the faculty and staff at YSPH. It would not be an exaggeration to say that Vicki has become a part of the very fabric of YSPH in her short but impactful time with us. Vicki, please come to receive your award. The Lowell Levin Award for Excellence in Global Health is awarded to a graduating student whose work addresses health promotion and global health. The recipient is selected based on their internship experience and overall academic record, as well as their academic achievement, leadership, and community engagement. Professor Levin was a dear friend to many, a YSPH alumnus on our faculty, the first head of the YSPH International Health Division. I'm very pleased to announce that the Lowell Levin Award for Excellence in Global Health has been awarded to, are you ready again, Georgina Esteves. I'll try that pronunciation again, Georgiana Esteves. Georgiana came to YSPH after working with the DERA Institute in Rio de Janeiro, Brazil for 5 years. The DERA Institute is a civil society organization that works to promote health and human development by implementing and fostering an integrated approach to fight poverty. She's also a registered nutritionist in Brazil and managed her private practice for 7 years until joining YSPH in 2020. Since her arrival, she's been a very engaged student in the Department of Social and Behavioral Sciences, pursuing the global health concentration as well as the maternal and child health promotion track. Through her passion for global health and by leveraging her past experiences, she helped to facilitate a global health signature internship with the DARA Institute. As a result, a current global health student will be working there this summer. Georgiana's academic performance in global health has been exceptional. Her thesis project is based on a highly innovative qualitative analysis documenting the role that fathers can play in supporting infant feeding and other caregiving practices in Ghana, West Africa. Her influential work is now informing UNICEF and other agencies on how to better design and implement effective infant feeding and maternal child health programs involving both adult and teenage fathers. Georgiana, please come forward to receive your award. Our annual YSPH Student Award for Outstanding Contributions in Diversity, Equity, and Inclusion, DEI for short, recognizes one or more graduating MPH students who have demonstrated a significant contribution towards creating and fostering a diverse and inclusive community while at YSPH. I'm pleased to announce a three-way tie for this award to Lauren Nicole Cueto, Ivy Duong, and Simileyulua Elizabeth Falaco. Let me try that. Simileyulua Elizabeth Falaco. These three award recipients were recognized for creating community and implementing programs to help bring students together. They did significant work in organizing efforts to increase a sense of inclusion and belonging for students at YSPH through a range of activities such as supporting recruitment efforts and organizing student events. And this wasn't an easy year to be doing this with all the COVID constraints. Students said, quote, "They have created such a welcoming and inclusive environment by producing group events that spoke to various groups of students and being valuable resources on campus for all students." Simileyua, Lauren, and Ivy, please come to receive your award. We're now going to present the Faculty and Fellow Teaching Awards. Acknowledge our teaching awards for this year's commencement. We ask that all teaching award recipients come to the stage to receive their award when their name is called. The YSPH Teaching Fellow Award recognizes a student who demonstrates outstanding performance as a teaching fellow, a TF as we call it, and promise as a future teacher. The recipient of the 2022 Teaching Fellow Award is Thomas Shao, a Tom, Tom is a second-year MPH student in the Department of Environmental Health Sciences. His nominator, Mike Weninger, says, Tom is a relentless bridge builder. From study parties to friends meetups to mentorship matchups, Tom organized countless opportunities for friends to be made and partnerships to be created. And when Tom's semester-end student reviews were analyzed through a sentiment analysis algorithm, Tom's score was the highest score ever achieved by a bios. Highest score ever achieved by a biostats teaching team member and nearly double that of the course instructor. When prompted for criticisms of Tom's teaching, the students had two suggestions for Tom. Pick a different hour to host your section. And number two, don't tap the microphone to test the room mic. Those were the two suggestions that he got. Those were the only two. Tom was beloved, as you can tell, and these critiques are as harsh as it gets. Students underscored that he's patient, understanding, and determined to ensure that students leave his section feeling confident about what they have just learned in EPH 505. Students also expressed that Tom is so awesome, so approachable, so knowledgeable, and flexible. People say that about me, don't they? No, I guess in fact they don't. He was super helpful, especially during lab, when many of us are learning to code for the first time, and I really appreciated that he sent kind and supportive notes to us throughout the semester. Tom, finally, please come to receive your award. All right, and we now turn to the faculty. The YSPH Distinguished Student Mentoring Award recognizes a faculty member as a leader in shaping the next generation of public health professionals, and one who serves as a role model, conveys passion for public health, has clear and high expectations, encourages students to achieve their full potential, is sensitive to student needs and concerns, and makes extraordinary efforts to help their students. Candidates for this award are nominated by graduating students and are selected by a committee of both students and faculty. This year, the 2022 recipient of the Distinguished Student Mentor Award is Dr. Ijeoma Opara. Dr. Opara, who's been here about a year, is an assistant professor in the Department of Social and Behavioral Sciences at our School of Public Health. She is the founder and director of the Substance Abuse and Sexual Health Lab, www.oparalab.org. Her research interests focus on HIV/AIDS, STIs, and substance abuse prevention for urban youth, including racial and gender-specific prevention interventions for Black girls, and community-based participatory research with urban youth. Dr. Opara was praised by students for being an inspiration. They wrote, "In order to be an inspiring mentor, a professor must possess the following qualities: ability to provoke original ideas, dedication to their work and their students, compassion, and ability to instill passion in their students." Dr. Opara exemplifies all of these qualities. Students also wrote, Dr. Opara is the epitome of the positive impact exceptional mentors can have on minority students at elite institutions. Ijeoma, my friend, please come to receive your award. 21 months. The Distinguished Teaching Award, also called Teacher of the Year, is the school's highest honor for its faculty, bestowed by its graduating students. Quality teaching is one of the most important influences on a student's experience at Yale, and this award recognizes the recipient's leading role in shaping the next generation of public health professionals. The 2022 recipient of the Distinguished Teaching Award is Professor David Paltiel in the Department of Health Policy and Management. The objective that guides Dr. Paltiel's scholarly activities is to promote a reasoned approach to decision-making and resource allocation in public health and medicine. Trained in the field of operations research, Dr. Paltiel designs and implements policy models and cost-effectiveness analyses. He has a special interest and expertise in HIV/AIDS and has published broadly on the cost-effectiveness of testing, prevention, treatment, and care, both in the United States and around the world. David is praised by his students for being excited by, quote, every student question, answering them with eagerness and appreciation for students' curiosity and creative critical thinking. He created a sense of community among his students and TFs by celebrating our growth and recognizing the specific contributions people made to the group's learning. I am so fortunate to have known and been influenced by Dr. Paltiel for all of over a quarter century, David. Please come forward and receive your award. I forgot to mention David's important work in COVID-19. He pivoted his experience immediately and made nationally influential contributions in that area. But this is all for teaching. This is not for that. So Tom, Ijeoma, and David will have their names inscribed on the awards wall on the first floor teaching area in 60 College Street. Next, we would like to acknowledge our new Faculty Research Awards, just initiated in recent years by our Associate Dean, Melinda Irwin. Our new Faculty Research Awards recognize distinguished peer-reviewed manuscripts. The research awardees were already highlighted in detail at our YSPH faculty meeting earlier this month to highlight the public health impact of their impressive research. However, I'd like to share the awards with you briefly. The Early Career Investigator Research Award is given to a YSPH faculty appointment assistant professor or associate research scientist who is either the first or last author on a given published manuscript. And we had a tie for this award. Congratulations to Dr. Kai Chen for his paper entitled Role of Meteorological Factors in the Transmission of SARS-CoV-2 in the United States. He published this in Nature Communications, and to Dr. Fan Li in Department of Biostatistics for his paper titled Sample Size Considerations for Stepped Wedge Designs with Subclusters, published in Biometrics. Next is the Investigator Research Award, which is presented to a YSPH primary faculty member of any track or rank who was first or last author on the published manuscript. Congratulations to Professor Becca Levy on the paper Impact of Media-Based Negative and Positive Age Stereotypes on Older Individuals' Mental Health, published in the Journals of Gerontology, Series B. And to Dr. Michaela Dinan on her paper, Analysis of Sociodemographic, Clinical, and Genomic Factors Associated with Breast Cancer Mortality in the Linked Surveillance Epidemiology and End Results in Medicare database, published in JAMA Network Open. Our next award is the YSPH COVID-19 Research Award, granted to a YSPH faculty member or group of YSPH faculty whose original research published in 2021 focused on COVID-19. Congratulations to, are you ready, David Paltiel and Jason Schwartz on their paper, Assessing COVID-19 Prevention Strategies to Permit the Safe Opening of Residential Colleges in Fall 2021, published in Annals of Internal Medicine and recognized as one of the highest impact papers in that journal that year. And Drs. Chantal Vogel, Professor Albert Koh, Professor Saad Omer, and Dr. Nate Grubaugh on their paper, The Impact of Circulating SARS-CoV-2 Variants on mRNA Vaccine-Induced Immunity, published in Nature. Our next award is the YSPH Health Equity Research Award, granted to a YSPH primary faculty member's exceptional health equity-related original research published in 2021. Congratulations to Dr. Yusuf Ransom on his paper, Neighborhood Social Cohesion and Inequalities in COVID-19 Diagnosis Rates by Area Level Black African American Racial Composition, published in the Journal of Urban Health. And Dr. Tarika McCall on her paper, Development of a Mobile App to Support Self-Management of Anxiety and Depression in African American Women, a Usability Study, published in JMIR Formative Research. The Team Research Award is our final research prize, granted to a YSPH team of 2 or more primary faculty members, with 1 faculty member either being first or last author. Congratulations to Hannah Ehrlich, Amy Bay, Dan Weinberger, Josh Warren, and Sunil Parikh on their paper entitled Mapping Partner Drug Resistance to Guide Anti-Malarial Combination Therapy Policies in Sub-Saharan Africa, published in the Proceedings of the National Academies of Sciences. And Tyler Shelby, Xin Zhao, Donna Spiegelman, Loretta Grau, Linda Nicolai, and Luke Davis on their paper entitled Lessons Learned from COVID-19 Contact Tracing During a Public Health Emergency, a Prospective Implementation Study, published in Frontiers in Public Health. Let's have a round of applause for all of these outstanding investigators. Now is the moment you've all been waiting for. We take time to honor all of our MPH graduates. Can our graduates please follow the direction of staff to proceed to the stage? When your name is called, please cross in front of the podium to receive your diploma from me. We will forego handshakes given continued SARS-CoV-2 viral transmission. The president, the Yale School of Public Health Alumni Association will be giving you your pin and welcoming you to the AYAPH, the Association of Yale Alumni in Public Health, of which you are now members. And it is my pleasure to introduce Dr. Mayur Desai, Director of the Advanced Professional Program, who will introduce the candidates for the Master of Public Health degree in that program.
Esen Khalid Abu Alanain. I'll go ahead and read the names of those who aren't here as well. Friedrich Leopold Ackerman. Abinet Matthias Aklilu. Richa Atre. Amit Bardia. Lawrence James Castillo. Li Ling Chen. Dante Costa. Kara Roslyn Costanzo. Kingsley Cruikshank. John Paul Singh Deol. Allison Langford Duran. Oluwatomini Ayumide Fashina. Todd Gulick. Dan Patrick Gallagher. Keller. Frank Masige Willie Kusaga. Jaewon Lee. Christopher Lawrence McLucas. Gayatri Teresa Narendran. Barbara Awar Odak. Rujvi Pareshkumar Patel. Ashok Krishna Perumal. Matthew Dylan Pitchert. Rock C.J. Positano. Richard Robert Rodriguez. Ahmad Rafat Saleh. Zia Shakir. Girija Shetkar. Richard Smith. Wan Yi Tang. Jean Verheiden. Hui Emily Young. Cushion Zhang. It is now my pleasure to introduce Professor Shungu Ma, Chair of the Department of Biostatistics, who will introduce candidates for the Master of Public Health degree in that program.
It's my great honor to introduce candidates for MPH in Biostatistics, Dae Chen. Yanjun Chen. Yingtong Chen. 卓琛、一代、韩凤凰、一将、柴云 Kim、肖范六、恩浩马、于路盼、Megan Panner、瑞玲兔、伊廷旺、梅林站。Now it's my pleasure to introduce Dr. Judy Lichtman, Chair of the Department of Chronic Disease Epidemiology, to introduce candidates for MPH in that department. Thanks.
It's a pleasure to be able to announce our candidates. Mahana Alayami. Nicole Ann Ancheta Ballesteros. Paola Bocores Ramirez. Lauren Nicole Cueto. Holly Nicole Dowd. Natalie Sophie Henning. Catherine Lewis Ho. Dana Norbert Joseph. Esther Chu-Wan Kang. Erica Ann Fumiko Kim. Danielle Marie Klein. Hang Lee. Megan Elizabeth Lindsay. Marie Claire Meadows. Carlos Mauricio Mejia Arbelais. Chinenye Marianne Okarfor. Connor Jesse Peck. Shamar Samuel Smalls. Jasmine Yishin Su. Vanny Topkar. Mei Wang. Rianne Michelle Wang. Joseph Williams. Clara Ming Hei Wang. And just reading one last name, Yunfan Chang. It is now my pleasure to introduce Dr. Vasilis Vasiliou, Chair of the Department of Environmental Health Sciences, who will introduce the candidates for the Master of Public Health degree in that program. Thank you.
Hello, I'm honored to introduce our MPH candidates. Giselle Rita Maria Belia. Zachi Chui. Leora Nina Fixel. Emily Elizabeth Johnson. Brady Keith Roy. Once again, let's call Tom Sao. Phoenix Rangchan Schwang. And Yakwen Zhou. Thank you. It's now my pleasure to call Dr. Linda Nicolai, Interim Chair of the Department of Epidemiology and Microbial Diseases, who will introduce the candidates for the Masters of Public Health degree in that program.
So it is my great pleasure to introduce the following candidates. Eliana Sophia Barbell. Anne Victoria Lokalani Basting. Aishwarya Bhattacharya. Eli Franklin Bierman. Kendall Billig. Lily V. Carruthers. Allison Catalano. Bakr Hussein. Robert Tobias Toby Cook. Hannah Lemansky. Ye-Chi Lee. Zitong Lin. Yizong Liu. Rachel Amanda Loeb Castonis. Caroline M. McWilliams. Sarah Yukari Michaels. Guinevere Van Buskirk Oliver. William Thomas Pelletiers. Hannah Peterson. Thomas Arthur Grant Quijano. Alexander James Robertson. Hannah Jane Sprock. Mengting Su. Mary Martinovna Tate. Alice Zhao. It's now my pleasure to introduce Dr. Howard Foreman, Director of the Healthcare Management Program, who will introduce the candidates for the Masters of Public Health degree in that program.
Do I have? Yep. It's my really distinct honor to introduce the candidates for the Masters of Public Health degree in the Healthcare Management Program. Hold on. We're back. Yeah. I'm the only one who didn't print my own thing, but, you know. Rahma Ahmed. Saron Araya. Daisy Bourne. Victoria Ashley Clark. Isha Dave. Michelle Delwasson Baum. Patrick Dempsey. Mila Dorji. Yushwan Du. Ivy Duang. Benjamin Paul Engler. Sarah Gannon. Derek Kenneth Gaucher. Tyler John Kellenberger. Jing Wen Lee. Lydia Jinma Lee. Mei Lee. Yushwan Lee. Shun Lu. Sija Ma. Tyler Miao. Hillary Judith Moss. Phyllis Nahutaba Panache Mugadza. Benjamin Thomas Rosen. Qingyan Shen. Ritesh Kumar Singh. Kevin Soon. Melanie Suzanne Taub. Xiao Wang. Wei Zhang. Xiaohan Zhou. It is now my pleasure to introduce Dr. David Paul Teal, professor in the Department of Health Policy, who will introduce the candidates for the Master of Public Health degree.
For the Master of Public Health and Health Policy, Christian Abraham. Priscilla Badu Sakir. Nicole Brussel Faria. Good pace. Shannon Carter. Jacob Chen. Rebecca Gilman. Julian Johnson. Sarija Condetti. Guiyu Lee. Elaine Loudon. Laura Macon. Megan Malloy. Anna Marguerite Rabal. Miranda Rector. Ian Riley. Oh. Wait. When you already have one Yale degree, why do you need another, right? Where was I? Leah. Leah Robinson. Job, Ian. Madeline Josephine Sale. Meg Stellini. Elise Vanderwood. And Isabel Sky Warner. It is now my pleasure to call Dr. Trace Kershaw, Chair of the Department of Social and Behavioral Sciences, who will introduce the candidates for the Master of Public Health degree in that program.
All right, SBS, let's take this home. There we go. All right. Natalia Castellanos Gonzalez. Maya Frances Tracy Dennis. Let's wait till they cross. Nandini Deo. Good job, Nandini. Betty Duran Becerra. Georgiana Esteves. Simalea Lua Elizabeth Falaco. Good job, Sammy. Xiao Fan. Paige Fahrenkopf. Good job, Paige. Hannah Carolyn Gorman. Audrey Ying'an Huang. Emily Zhen Ning Huang. Margaret Cavendish Kellogg. Caroline Alexandra McGee. Rashika Mohante. Christine Pham. Senite Pierce. Jasmine Teresa Rios. Janet Arena Rohina. Mariko Fujimoto Rooks. Bailey Frida Jean Rue. Kala Maxine Pasquale C. Kendall Naomi Watanabe. Julia Michelle Winchell.
Class of 2022, please stand, all of you. Congratulations to you all. You may be seated. Thanks also to our program directors, representative of AYAPH, our chairs, our associate deans, and especially Frank Grosso and his extraordinary team, not only for this ceremony, but for our lunch. We're very grateful. I would like now to take a moment to acknowledge our friends who aren't here, the YSPH students receiving their PhD and Master of Science degrees from the Graduate School of Arts and Sciences. But they're really ours, don't you think? The 21 doctoral graduates and 33 MS graduates are listed in your program, and they are recognized more fully through Yale's Graduate School commencement events, which is where they are now. Please join me in recognizing all of them with a round of applause. I immediately see that the dean's closing remarks are a little too long, but don't worry, we'll be there. We're seeing the light at the end of the tunnel of this extraordinary day. As we approach the end of our ceremony, I address you, the YSPH class of 2022. The degrees you've been awarded today are a testament to your commitment to promoting wellness in communities, promoting health equity, and alleviating human suffering through the field of public health. The faculty and I salute you for your perseverance, especially through the travails of the COVID-19 pandemic. We also wish to thank again all the families and friends of the graduates for joining us in this celebration. All of you in attendance, families, faculty, and staff alike, have encouraged and inspired our students to succeed in this exciting stage in their career studies. Yale University also wants to acknowledge that Indigenous peoples and nations have stewarded through generations the lands and waterways of what is now the state of Connecticut. We honor and respect the enduring relationship that exists between these peoples and nations and this land. Graduates, you're moving on to your job searches, your new jobs, or your continuing doctoral or professional studies at a time of true crisis in our nation and the world. Rather than facts, some would promote lies and so-called alternative facts. Rather than policy built on an evidence base, some would promote partisan fictions for their own short-term gain. Rather than strengthening fairness and democracy, some would roll back the clock to restrict voting and biasing electoral processes. America First was the motto of Americans who were pro-Nazi in the 1930s. America First is now the motto for pro-authoritarian, pro-aggression, and racist and anti-immigrant philosophies in the 2020s. What then are scientists to do to help guide policymakers and sincerely motivated political leaders? I suggest 3 strategies. First, make every effort to take your peer-focused research publications and your professional presentations into a community context. This is easier than ever with strong social media and online publication options. In this way, you will democratize science, bringing lay descriptions of your work to persons who will never read it in Nature, JAMA, or the American Journal of Public Health. Second, seek to engage your local online or print newspapers with editorials, with commentaries to counteract misinformation that is promulgated by anti-science forces. Third, try your very best to clarify scientific and social misinformation in your family and friendship groups, your local parent-teachers associations and governments, and your fraternal organizations and places of worship. Listen to alternative points of view and seek to find common ground, but then address misinformation. Trust me, with your public degree in hand, your legitimacy will be enhanced and you can change hearts and minds. I would be remiss in not acknowledging the acute suffering of our fellow human beings in such settings as Rohingya or Syrian refugee camps in Afghanistan and Yemen, in the Tigray region of Ethiopia, and most notably in Ukraine. Less obvious at present is the growing climate change migration of persons displaced by desertification, deforestation, water and food shortages, and disturbed fisheries and agriculture. Also less obvious is the continuing crisis of suboptimal nutrition and sedentary lifestyles, obstacles to healthy aging, inequities in access to health care, ongoing harmful substance use, links to suboptimal housing and health, systematic socioeconomic disadvantages, infectious threats, and toxic environmental exposures. We can influence all these challenges, but we must make our science accessible. YSPH has made major strides towards improving our communications to the public and our policymakers. We intend to do much more. I invite you to stay in touch with us and partner with us and the broader Yale community, including our alumni, we want to advocate towards broad welfare of humanity, particularly those most vulnerable due to systematic economic and housing discrimination that might lead to food deserts, risk of injury and violence, educational disadvantages, and so many other health-linked social issues. The good news is that in our profession, we spend our professional lives working towards mitigation of these legacies of structural disadvantage, health inequity, racial discrimination, and extreme economic disparities. We strive for improved health systems and functioning. We seek cleaner environments and addressing the greenhouse gas emissions crisis. We identify and mitigate the social determinants of disease. We seek to motivate and facilitate healthful behaviors. The personal and community antecedents of rising chronic diseases and ongoing infectious disease threats are characterized, and then interventions are designed and promulgated. Importantly, The methods of public health in such disciplines as biostatistics, health data sciences, health informatics, and implementation sciences are the source of discovery and innovation. Our global partnerships enable discovery and capacity building in low and middle income countries, and our students are in the center of so much of this work. We are privileged to be in the field of public health, and your faculty are pleased to honor you on this day of your achievements. Finally, thank you most sincerely to our student affairs team that I mentioned a moment ago. They've worked so hard. Dean Grasso, Registrar Stacy Tuttle, alongside my own colleagues in the Office of the Dean. They've supported you for the past few years, starting during the application process and throughout your graduate experience at Yale. Please join me in thanking them for everything they've done throughout your graduate training at the Yale School of Public Health. Please stay in touch with your old teachers and the AYAPH, our Association for Yale Alumni in Public Health, in which you are now subscribed. Let us know about the work you do, your successes, and your willingness to advise current students, mentor them, to receive future summer interns in the positions that you find yourselves in, and to contribute to the annual alumni fund for their scholarships in the future. We will always value your advice and your support, and a personal thank you to students, staff, and faculty for their support of my 5-year tenure as your dean. This concludes the YSPH Diploma ceremony. We ask that guests remain in their seats until the representing faculty members have departed.